Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1. Questions 31 to 36. You hear an interview with Dr. Helen Sands about her work with patients who are learning to cope with amputation. You now have 90 seconds to read questions 31 to 36.
I'm joined today by Dr. Helen Sands, who works with patients who've had limbs amputated. Now, amputation is an extremely traumatic experience for patients. Helen, in your experience, how do younger patients tend to react to it?
Well, in a range of ways, depending on whether the loss was expected, if it was due to chronic illness, or to something sudden like an accident. One of my young patients in that situation, let's call him David, said losing his leg suddenly was like the pain of an unexpected death in the family. And although this didn't really apply to him, for many young people, even watching a football game can make them feel shut out of activities they once took for granted. But then others come to terms with the fact that for them, normality will be something different from what it was before the operation.
And patients can still suffer pain from a missing limb, can't they, even after the limb's been amputated? What's called phantom limb syndrome. How common is this?
Well, the phenomenon was first observed many years ago in soldiers who'd lost a limb in combat. The majority reported pain coming from the missing limb. Obviously, surgical techniques have improved, but a large number of amputees still report suffering from a degree of pain from the missing limb. In a few instances, this might be due to a poorly fitting prosthetic, for example, or residual limb pain, but the majority of cases are harder to explain. And patients are reluctant to talk about it in case medical professionals doubt their mental state, so it's not very easy to say just how often it occurs. However, I still tend to think it's large numbers.
And you must have come across examples of this phantom limb syndrome in your own patients who have missing limbs.
Oh, yes, of course. Many patients report feeling as if the missing limb is still attached to their body, even years after the amputation. Some patients have reported actually trying to use it just as they did before. And in the case of other patients, they feel as though the missing limb is permanently at an abnormal angle, and they have to make allowances for it when moving around. I've come across a number of instances of that. And other patients experience what we call telescoping. The sensation that the limb is still there is normal, but it's become smaller, shrunk somehow.
And I understand that you have a treatment trial going on in the hospital at the moment.
Well, yes. In the normal course of treatment, we administer analgesia, and we also make use of local injection therapy using pain-blocking agents. Unfortunately, though, these don't always work as well as we might like. So we're working with a group of patients who have reached the point where the pain's badly affecting normal activities such as sleeping and going to work. All patients in the group have suffered from phantom limb pain for 10 years on average. So they're the most extreme cases we could find.
So how did you set about treating the patients in the trial group?
Well, when a limb is lost, that affects a number of brain functions, and we wanted to try to restore those functions. So we attached electrodes to the remaining muscles of the stump and then asked patients to try to move the phantom limb. And patients could view their virtual limb moving on a computer. But they couldn't just imagine moving the limb, they actually had to force their brain, if you like, to perform the action. Because only then would these circuits, these pathways, be restored in their brains. So the patient controlled the virtual limb just as they would have with their own limb. And slowly, they got better at doing this in a way that was productive to the brain. And patients invariably reported that as a result, their pain diminished.
So the treatment was useful. Does it have any other advantages?
Well, we followed up patients after different periods of time, and the improvements were still there, but not to the same degree. But the decrease in pain levels was still statistically significant. But this kind of treatment is very easy for patients to do at home once they've left the hospital. They only need a computer with a webcam and the program.
And this research is ongoing, of course, so we can look in more.
Now look at Extract 2. Extract 2, questions 37 to 42. You hear a dermatologist called Dr. Jake Cooper talking about a skin condition called hidradenitis suppurativa, HS. You now have 90 seconds to read questions 37 to 42.
Hello, my name's Jake Cooper. I'm a dermatologist, and I'm going to talk about a skin condition called hidradenitis suppurativa, commonly abbreviated to HS. Let me tell you a bit about this condition. HS is a chronic inflammatory disorder characterized by painful swollen lumps on the skin, which may break open, releasing fluid or pus. It's also called acne inversa, and in fact, sufferers often think they've got acne or pimples. But unlike acne, HS affects apocrine gland-bearing sites, in particular the armpits and the pubic regions. It's not a very well-known disease in the medical community, which is surprising, as it affects about 1% of the population, and early occurrences are commonly misdiagnosed as simple nodules or abscesses. This is unfortunate, as the condition can be very distressing for the patient. We don't know exactly what causes HS, though it seems to be linked to blocking of the hair follicles in the affected area. It tends to occur most often in younger females, and it's often found in patients who are overweight. Studies carried out into a possible link between deodorant use and HS have so far been inconclusive, but the condition is more prevalent amongst smokers, and there's some evidence that nicotine may affect the follicles. Patients sometimes worry that they've caused the condition by shaving, or possibly by using depilatory creams, but there's no evidence that either is a contributing factor. Let me tell you about one case I encountered recently. This was a 22-year-old woman called Sophie, who came to see me because she had a number of painful boils in her groin. These had been occurring with fluctuating severity for the previous 3 years. When I questioned her further, I learnt that she'd previously undergone incision and drainage of various lesions on multiple occasions at various medical centres. She also told me that she'd taken a course of an unknown oral antibiotic to treat an abscess about 2 months earlier. So I was able to put 2 and 2 together and make a connection with HS. Then we could start to think about the right sort of long-term treatment for her. When treating patients with HS, it's important to be aware of the impact it can have on them. Many studies have confirmed that patients with HS commonly experience depression as a result of their condition. Additionally, HS has a significant psychosocial impact. Patients reported feeling unworthy and unlovable, and described their lesions as ugly, smelly, and embarrassing. In some cases, symptoms may spontaneously resolve themselves for long periods of time. But both doctor and patient need to remember that there could be a flare-up years or even decades later, and that currently, treatment is limited to finding a way to manage the condition. HS may present itself in younger patients too. In another case, I saw a 14-year-old girl called Emily, who came to see me with her mother following a diagnosis of HS by her GP. We needed to confirm the diagnosis and decide on the most appropriate treatment. Her mother expressed concerns about what she referred to as Emily's unappealing hygiene. This was said in front of the girl. Now, we know that HS is notably not due to poor hygiene. While HS is a skin disease, it's happening lower in the dermis than just the surface level. In this case, Emily had a lesion on the mons pubis, which required surgical intervention. Following incision and drainage, her condition improved, but this does illustrate the need to consider not just the patient, but also the attitude of family members. In general, when it comes to treatment, once we make a diagnosis, there are multiple therapies indicated, depending on the severity of the disease and patient presentation. One thing patients often ask me is whether they need to make changes to their diet. One small-scale study followed 12 HS sufferers who cut out beer from their diet, together with other foods containing yeast, such as bread and some types of cake. And this did appear to have an effect on their symptoms. It's also known that overproduction of one group of hormones called androgens may contribute to the symptoms of HS. These hormones are linked to insulin, and foods such as milk and cheese can raise insulin levels. So reducing these types of foods might be helpful. However, a controlled diet, which leads to weight loss, is certainly recommended for patients who are overweight or obese.
That is the end of Part C. You now have 2 minutes to check your answers.